provision of healthcare delivery system is one of the basic fundamental human rights which citizens are expected to enjoy. For the Abdullahi Sulei's administration, healthcare remains a critical focus in achieving a healthy society. To ensure that words are matched with actions, factors like proper budgeting, policy implementation, facility upgrade, and adequate health insurance scheme plays a huge role in delivering the dividends of democracy. Whether it is primary healthcare across Nasarawa State or boosting tertiary health institutions, Governor Abdullahi Sulei in the last 3.5 years has been championing a revolution. Hello and welcome to Nasarawa Focus. My name is Godwin Agwam. The health and well-being of human race is one of the 17 objectives of the Sustainable Development Goals, SDGs. Since assumption of office, the Abdullahi Sulei's administration has given much priority to the health sector. This is in view of the critical role the health sector plays in the overall development of the state. This is in the light of the saying that a healthy society is a wealthy society. To demonstrate the administration's commitment to achieving this goal, it increased the budgetary allocation of the health sector from a single to double digits. This is in line with the 15% required by the Sustainable Development Goals for the health sector.
Since our coming, I believe, period to His Excellency's coming to office, the allocation to health were on a single digit, 8%, 9%. On the first year of Nasarawa, our allocations in budget allocations was about 10%. On the second year, we have had improvement to 11%. The third of this year of last year, I think we have improved up to 12% allocations of such budgetary. The others of comfort of such is the budget implementations and the releases. And this has also have seen an improvement to that cadre. And honest to this again was the influence of transparency and accountability of governance in which this government has also displayed.
Proper budgeting and implementation has been an energizer for the government in its strive to reposition the state tertiary health institution, the Dahatu Ara Specialist Hospital, to meet global best practice. This the government was able to achieve through the training of doctors to be consultants, employment of trained consultants, as well as through training and rehabilitation of all strata workers, among others. This is aimed at boosting its manpower resources to meet the ever-growing demands of the healthcare services.
The administration of A.A. Sule has concentrated on these two other functions apart from just the service delivery, and we have made significant improvements in terms of training, both undergraduate and postgraduate, and in terms of research for prevailing illnesses that are endemic, especially in this environment.
Some consultants who are product of the hospital speak on the impact of the training.
The residency training in Osangani department in Dash is of high quality because this place is a referral center where many patients are being referred to, and we see a lot of complicated cases in these hospitals. So this has actually given us opportunities to manage patients with complications properly. And also during the course of the training, we were exposed to so many complicated cases. That's an added advantage of being trained in this hospital.
The residency training in Dash is quite good. Recently, it has produced several consultants in O&G, in family medicine, and then in pediatrics.
The state government recently procured 2 dialysis machines for the treatment of people with kidney issues in the hospital. This has brought respite to patients who travel to other neighboring states for treatment.
Time that I you take the record of the weight, then it goes home. The time it's coming back again, you have to weigh it again. If you have taken a lot of water to overweight, then it is that overweight that you remove from the patient. And you weigh the patient before you treat the patient again.
With the coming of the administration and the felt it is good to have new machines on ground so that our patients will not suffer. And so the government, in its own way, produced 2 Fresenius machines, and they are quite new, and the model is the best of all in the country. And so they produced 2. And since these machines came, we no longer refer patients out again.
The hospital has transformed the eye clinic into a full-fledged complex. It has also increased manpower to cater for the numerous eye diseases.
The works in terms of a range of eye diseases. Commonly we have allergic conjunctivitis, which becomes worse in certain seasons, like the dry seasons we are at now. We have other conditions that may be blinding, like cataract, which is the commonest cause of blindness. We also see a huge number of patients coming with glaucoma. We see chalazion, we see pterygium, we see all kinds of eye diseases. Some range from diseases caused by systemic conditions like diabetes, hypertension, people with thyroid eye disease. So we see a range of eye diseases.
Initially, or in the past, we had just, I think, 2 or 3 rooms that comprised the eye clinic or eye department in the hospital. And eye elements are among the most common almost anywhere in Nigeria. So we needed expansion, we needed additional staffing, and we've gotten the additional staffing. We have expanded the eye clinic or eye department, and now we have a complex, a modern complex for eye elements, and it has gone a long way in alleviating the suffering of people here. In the past, people used to go as far as Kano, Gombe, Bauchi to access eye care. But now we have a modern complex, we have consultants, we have residents that are providing those services, and it is one of the busiest departments in the hospital.
Jato Emmanuel and Mohammed Likita are patients at the eye complex. They are delighted with the state government for providing an ophthalmology unit of international standard.
Yeah, they are doing their best, because if you see the rate of patient dropping here, if they are not doing their best, you can't see anybody here. But because of the facilities they have and the competencies they have, the patients are dropping here for the eye treatments and the rest of them.
The secondary health institutions are not left out in this revolution in the health sector. Only recently, the state government ensured that adequate equipment are procured and installed in 3 model hospitals across the state. These hospitals are under the direct supervision of the State's Hospital Management Board.
You will find out that we have diagnostic tools such as X-ray machines over there, and then the 4D ultrasounds that are being used, and then dental chairs also. And when you now look at the environment or so, he has really tried to improve the environment for the patients and also staffs that are also working there. And apart from that, again, he has also tried to engage some consultants that will be going to that place so that the specialist care can be provided at the secondary health care.
Is deploying highly skilled consultants from tertiary institutions to secondary facilities up to primary healthcare, so that some of these highly skilled activities that led to mortalities of our women and children can also be reduced drastically to an insignificant level.
The model hospital in Akwanga is a true reflection of what is obtainable across the 3 senatorial zones of the state. The hospital is bequeathed with a state-of-the-art facility such as a 4D ultrasound machine, a well-equipped laboratory, a well-equipped dental unit, and a digital radiography unit.
Digital radiography machine. This one. Yeah. Okay. And here we have the couch, which is the bulky, the supine bulky, and then we have the erect bulky here.
Structurally, all departmental are highly represented, both dental, mental, laboratory, pharmaceuticals, and beyond such, nutrition and other areas of concern are established, including the image scientists and other radiologists and other activities are available, and you can as well access them. This has also been to know why the tertiary institutions and highly skilled professionals have agreed to also extend their own professional services to those areas because equipment and other tools are available. You can easily access, affirm to the decisions of diseases, and treat accordingly.
Some patients express satisfaction with the facilities and services available at the hospital.
In fact, I didn't expect I will come and see all these facilities here because we have 24 hours light here. We have water 24 hours here, and all the workers, they are busy throughout the night. If you have problem, you get them sitting wherever they are located and tell them your problem, they'll come and attend to you.
They are really trying because when I came yesterday, I don't think I will even survive, but truly the nurse really tried because since when I came, they are just up and down attending me, so I really appreciate them.
The state has been ranked as the first in the COVID-19 vaccination across the country. This is courtesy of the state government's efforts through the Primary Health Care Development Agency.
Ladies and gentlemen,
I think one of the things is because of the level of who we involve. So one, our population has helped, that is the truth. Our fear that we are too close to Abuja and we are exposed to this danger of Abuja also has helped, to make sure that people are taking it very, very seriously in the state. And then the effort of government for the fact that we go out to the market, we do that, and the primary healthcare in the state. As you know, the chairman of the state primary healthcare happens to be also the state of the chairman of the whole other chairman of the country. So he also doing the best he can to make sure that he shows some effort. So it's a combination of so many efforts. Our community leaders have taken it seriously, our people are serious about it, and we are going out there to do so. That's the reason why I think we are the first.
First time while the vaccine came in, His Excellency availed himself before the public and before you, the media, to take the first dose of the jab for the COVID-19. Well, the cabinet, deputy governor, and others follow suit, including the Emirates and faith organizations, where most of those disbeliefs for vaccinations were on, also queue in that direction, and they advised us for the first jar of the vaccines. This again, with community head, philanthropies, and even the media, those who were also keen to showcase to the world the safety, the acceptance, the willingness of every individual to contribute in taking up this.
The Nasarawa State Infectious Disease and Diagnostic Center is a masterstroke of the Abdullahi Sulei's administration. Despite having a structure in place by the previous administration, the incumbent administration ensured adequate equipping of the facility.
Well, the number one service, as you know, is a center for research as well as all other infectious diseases. It is not restricted only to COVID-19. It extends to so many other diseases such as Ebola, as you can mention, in fact, to extension malaria, Lassa, and so many other diseases that you can think of. So that's the idea about the center. But more importantly, it's a research center as well. Being a research center, it is likely going to come up with a lot of ideas, with a lot of reports that are going to assist our existing hospitals and the rest of them.
That research center is made in such a way that some of the isolation units can even take cases that are unknown causes on the spread of that with the facilities of the best of what is also equipped there. We're also expecting about over 2 billion naira worth of infrastructure investment is also expected to also fill there. With the options of COVID as an isolation center, we also have a very robust laboratory setup that are able, detectable for any measure from a microorganism detection of quite of infections of other that can also be. For now, we've sent a bill to establishment of the state assembly. They've passed the first reading, and they also make the second reading. I think the third readings and onward, the bill, passing of the bill to citizens for assent is very, very close.
Today, the facility has the capacity to diagnose and treat COVID-19 and other viral diseases, while efforts are on top gear to enhance the capacity of the facility to cater for other communicable diseases.
CR actually does 96 tests
is bigger than the one we've just seen, does 48 tests. They all have the same, they are all real-time PCR. You can use them to amplify any viral template.
The vision, the initial vision was just for a few viral infections. We'll call them hemorrhagic viral infections, but the mandate of the new administration of Engineer A.S. Tuli is to broaden the horizon. And so we're not just looking at those hemorrhagic, we'll not be looking at those hemorrhagic viral agents. We'll be looking at a broad spectrum of emerging, re-emerging, and neglected tropical agents, infectious agents.
No wonder the state was effective and efficient in the management of COVID-19 with low numbers of confirmed cases and deaths.
The entire state was covered with surveillance and all information was at the table, and with an open door policy and very attractive attentions from His Excellency in our lives today. They are virtually in every single council and advice we put through for us to halt the spread of COVID-19 and mitigate the menace of what COVID will go through. Was given attentions and approval was given to us. I believe we have the best potentials of governance, and resources were mobilized from all angles, and rules and ethics and laws were also put to shore through the Minister of Justice, who was also a member of the task force. And you bear witness whatever need to put across to the citizenry who were the better partaker in this fight of COVID-19, also abide by the state rules and regulations at that time.
In ensuring availability of healthcare for all, the state government established the Nasarawa State Health Insurance Scheme. The scheme provides opportunity for beneficiaries and the government to contribute in order to ensure free access to healthcare.
Of course, a premium must be paid, so either it's paid by you or it's paid by someone. Like those that are basic care provision fund, whether it's funded by the federal government or the state, someone is paying on their behalf, and that's the government. So for the civil servants, which is usually referred to as formal sector, the premium comes in two ways. There's a deduction from their salary, which is usually the basic salary, and then there's that component that comes from the government that match up. So government is the employer, while the civil servants are the employee. So that's how the contribution is, and that qualifies them to access care. So for those that are private, of course, they come and pay for their premium themselves. Those on adoption, either NGO or any philanthropies, pay for them as well. So that's how it's been. Premium must be paid, and once premium is paid, automatically, you access care.
As of today, the agency has enrolled 73,000 beneficiaries.
Those 73,000 include the civil servants and also those that are on different programs. Some of the programs we're already running are the state-funded Basic Care Provision Fund, and of course the nationwide federal, Basic Care Provision Fund.
The health insurance has come to enshrine among the 36 states of the state. I think Nasarawa State is among the few number of states who have grown to the extent of the status we are today. It is in the know that in the 10 nations, over the statistical presentations of the expected indicators of performance of health insurance scheme, Nasarawa State is at a greater ladder of among the highest, best performing 6 to 7 states in the 10 nations.
The Abdullahi Sulei's administration is working towards boosting the manpower of the health sector. This informed the recent handover of the Dahatu Specialist Hospital to Federal University of Lafia as a teaching hospital, and the establishment of a College of Medicine at the Nasarawa State University, Kefi.
The doctors were encouraging more and more medical students today. We are giving more scholarship to medical students. We are encouraging most of the people from Nasarawa State to do that. Our 2 tertiary institutions are now also offering medicine, but the Federal University. That's why we are converting the DASH to a teaching hospital, and we are also looking at the possibility of FMC also being a teaching hospital, because both the Federal University here in Lafia and the State University in Kefi, both of them are working towards offering medicine and as a result of that, both of them have already offered anyway, they are working on that, but life here is ahead because the students are actually in their second year right now.
Medicine in particular is not being offered in many of the universities. And there are many of our candidates who seek admission for these programs and they don't get. It was just recently that the Federal University Lafia started the medical program. And then we looked at that vis-a-vis also the manpower requirement in the health sector. We realized that there is some level of inadequacy of particularly medical doctors. And so we saw clearly the gap in terms of personnel, and we felt that there is a need to go in there as a university to support the state and the nation at large.
The government also upgraded the School of Nursing and Midwifery to a college and also ensured the accreditation of the institution's courses.
Immediately he came into the office, those are some of the problems we presented him, and he went ahead to employ more manpower. We had additional of more teachers, about 10 teachers were directly employed. New graduates were employed to the system, and then we also second some other, there was secondment from some other institutions to this place, to the school. And not only that, he released some funds, and those funds were able to help us to upgrade some of our facilities, where we you can see the current School of Midwifery. You can see it has looking very sparkling now, and they're also part of this School of Nursing here. We upgraded some certain areas, and that was how we were able to scale through full accreditation.
We have graduated over first set, believing that the second set will soon come to graduations. His Excellency has given an order to the Ministry of Health, and which has also been observed. The first 3 sets of the graduates of those schools are to be absorbed. The first set were graduated, the state have absorbed them. They have been distributed to primary health care to assist in enhancing our health status, both during delivery and our mothers and the child accordingly.
The good health policies of the state government has continued to attract private partners and investors into the state.
While we have 2 primary health care built by individuals in several areas of locality that only grace the His Excellency's occasion to commissions and also deliver it up to community. We'll be seeing the flux of such. 1 in total, there is 1 in Bukona, the other one is also coming in Nasarawa local government. We have 1 that's also coming in the local. We're looking forward to see where many other individuals will take health security, own it within the communities, and this has been a drive that will have come.
This revolution in the health sector, which is championed by Governor Abdullahi Sule, is a magic wand to keep the people of the state healthy in pursuit of its industrialization agenda. And that's our package from the solid mineral states, where Governor Abdullahi Sule is meeting the aspirations of the people and exceeding all expectations. Until the next one, it's bye for now.